Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS. And our guest now is Nola Aronson from Advanced Audiology. Welcome, Nola. It's good to see you.
Yes, good to see both of you again.
Yes.
Welcome.
Thank you.
And what are we talking about
Other
today?
than, can you hear us okay? I mean, I think there's something wrong with
Yeah.
my microphone.
Yeah, I think
So
there
that's
is
our
something
time.
wrong with my hearing, too. I've been noticing I've been saying what a lot more. So,
Really?
I'm getting up there now, and I have to find a good place to get a hearing test, Do you know one?
I wonder where that could be.
I don't know, but I just had one of the other audiologists, Dr. Ginny Veloz. She just took the wax out of my ear, so.
Oh, that was
Um,
the problem. You're lucky it was simple.
No, I still am having problems.
Oh,
We always think
afterwards.
that's what the problem is,
Right.
is the wax in the ears, but
Ah,
I'm still saying what. In fact, there was a patient I was just seeing a few minutes ago, and, I totally misunderstood what they said. So it might be my turn now. But
How
it's not a
interesting.
bad thing anymore,
not a
because
bad
now we
thing.
have these small little devices that are smaller than the Bluetooth that people walk around in their ears, and they're made so that you can understand speech clearly in a noisy environment, and you don't even know you're wearing one. So it's kind of exciting, and they come in all different colors, and it's really cool, so I won't mind.
so I guess one of the things that most people don't like about hearing aids is that you can see them. They might be bulky and things like that, but for some reason I don't care. If I have a hearing aid, it won't, it's enhancing what I need to be doing, so it won't bother me if you have a big antenna sticking out of it. I won't care. But others, I guess, worry about that, don't they, Nola?
Yeah, well, that's why I just had a couple in this morning, right before I came here, and the husband was saying, I'm not wearing one of those things. And the wife also has similar hearing loss, and she is willing to try. So I said, look, it's your quality of life. Now, when you go out to a restaurant, are you getting along? And they said, no, we don't even talk to each other in the restaurant because we can't hear each other. So I said, now, how does that enhance your relationship? Because if you can't communicate properly with somebody because of hearing, well, what are you going to do? The first thing you're going to have is a disagreement. You're not going to be able to agree on something because you didn't hear the person what they said. So all of a sudden you don't agree. Well, the next thing that happens is that, now you're not liking each other so much anymore, and you're starting to argue. And I was explaining that to them, and they totally agreed. And I said, what is the worst thing? The worst thing is we loan you the hearing aids on a trial basis for free. You get to take them home in your own environment and see if they improve your lives. And if they don't, give them back. It doesn't cost you anything. Because a lot of people will leave the office and they'll say, they'll go, well, I'm going to go home and think about this. And I go, well, what are you going to think about? Haven't you been thinking about it for years now?
Why are you here?
Right.
But what did that guy say this morning?
So
Did he
he
say-
let us test his hearing, so I don't know
Oh,
what's
good.
happening right now.
Okay.
Hopefully they're listening to me on the radio, and, I'm hoping he takes home a pair with his wife, and so they can see if they can get along better now.
Oh.
That's great.
So-
Well, there's a lot to be said for cleaning the wax out of your ear. And I think a lot of it builds up. And when you start putting things in to clear them out, you most likely push the wax further in.
Yes, you can do that. You can
Yes.
puncture your eardrum,
Get infected,
kind of all
So-
kinds of
all
problems.
kinds of things.
So
can happen.
what is a good way to clear the wax out of your ears? I know this doesn't sound like a very pleasant subject, but I think it's very important as far as hearing is concerned.
Well, really, you need to go see your doctor most of the time, but the doctor will tell you, you can go to the store and they have earwax removal kits. You can put drops in your ears. It's called Debrox. Or you could use hydrogen peroxide, right, Dr. Dorio?
You can, but you need to use half-strength hydrogen peroxide.
Oh, okay.
Don't put full strength in, because you'll hear the bubbling the rest of your life.
Oh, okay.
Really? Well,
See,
that
that's
makes
why
sense.
doctors
Makes
are
sense.
around.
Yes.
So I'm not a medical doctor, and but anyway, that's what we tell people, just to soften the wax. So then, if you go to the doctor to get the wax out, it will be easy to take out.
And there are ways of getting it out. I mean, we a lot of times flood the area with syringes and water picks and things like that, and usually it will come out by the professionals that have done it for a long time. We have not only ear, nose, and throat doctors doing it, but we have PAs, nurse practitioners, who do it, and they do a pretty good job. So
Yeah.
I'm not worried about it. I do think that the worst thing you can do, other than, Barbara, what you say, push the wax in further, is remember we used to have hairpins. A common thing for use
Right.
of hairpins was to clean wax out of the ear. Yeah, and
Yeah,
people
but
would get
How
infected.
would you
Right.
do that?
They would
They
stab
would
themselves.
go like that, and they'd stab the lining
Ooh.
and cause an infection.
Right.
So it was very common 30 years ago, not anymore now, but people are still putting a lot of things in their ear that they should not, and they know they shouldn't, including fingers and everything else.
Well, the Q-tip is the most common thing, I would
Right.
think.
Well, that pushes it
Q-tip.
in more. So
Yes, it
you're not
does.
supposed to put anything in your ear smaller than your elbow. What your mother used to tell you is still
Very
true.
true.
Smaller than your elbow. That's
Right.
very true.
So, so one of the things that Advanced Audiology does is we offer free hearing screenings for people. And the reason we do this is to educate people about their hearing. You don't have to have a hearing loss to come to see us, and you don't have to get a hearing aid to come to see us. We like you to come to see us so we can let you know what your baseline hearing is, so that down the road you maybe, like one of my patients was in a car accident, and luckily she came a year before and she had normal hearing. But after the car accident, the airbag blew up in her face, and she lost all of her hearing in one ear. But we were able to document that for the insurance company then, because now we can show that it was from the accident that she had this hearing loss, even though she was older. So that's one thing we like to do, is educate people. And so when people come in, we talk about how improved hearing can affect, can help their lives, and how not being able to hear can really affect your lives. Like this couple I was just talking to, I asked, do you stop going to things? Do you stop going out to dinner because you're not really in the conversation? Do you stop going in the meetings that you wanted to go to because you weren't able to understand the people that were there? And so then you start to isolate yourselves, and you start to get depressed. Then you start to also, I always say your hearing loss is more conspicuous than a hearing aid, because people start to think, well, do they have dementia? Do they have Alzheimer's? Are they just not friendly? What's wrong with them? They know something's wrong, they just don't know what that is. So that's what we're here for. We're here to educate people about hearing. It doesn't matter who you are. You don't have to be old to come in. You can, be in your 40s, 50s. Just come in and visit us. And it doesn't cost you anything.
And that evaluation should take place, especially if you're, like earlier you said, you're saying what a lot, or I didn't hear you, or having people repeat. But the quality of life that you mentioned is important too, because your quality of life starts to suffer. And sometimes people get into accidents because they don't hear the siren that's blaring from a ambulance that's close by. Sometimes they don't hear their telephone ringing or their doorbell ringing.
Right.
Sometimes they've lost the use of watching TV or listening to the radio, or like you said, having personal conversations.
Right.
These are all lost, and they have a detrimental effect in the long run on a person and how they live life.
That's
So
correct.
get that screening test, because you really don't, you could have a mild deficit and you don't need a hearing aid. But with time, if you go back 5 years and get another hearing test and say, oh yeah, it's decreased again, you'll start to realize that at some point your deficits are going to be great enough to, yeah, you might need a hearing aid, but it's also going to affect your life. So become aware. If you know that you're starting to have a problem, follow it. Don't just let it go and say, I'll get a hearing aid or a hearing test. When it starts to be a problem, get it early so you can follow the baseline.
Well, see, like you guys are wearing glasses, right? You don't think twice about wearing glasses. But because of the old days where hearing aids were gigantic and big and it meant you were getting old, that's the reason why people don't want them. They don't have a concept of what it's like. I love when people come in and they start crying after I let them use the hearing aids for a couple of weeks. And I go, what's going on? I didn't know I was missing that. Oh my God. And they just feel so happy. And that is the purpose of advanced audiology. The purpose is to help people communicate better, to lead better social lives, thereby feeling happy. And when they're happy, they're going to refer somebody else to us. So that is our purpose. Our purpose is not selling hearing aids. We're not a sales place. We're not a store. We're professionals. Which is, on another note, we just were able to get the contract with UCLA. So we are now the providers for FACE and for UCLA. And so that's very big because a lot of people have those insurances. Now, other people in the area accept, quote, insurances, but they don't have the contract. So you have to watch out for that because you can go in and you can have benefits, but your benefits will not be covered unless you come to an authorized provider.
Oh, that's
such
interesting.
as ourselves.
That's interesting. So you are now covered under those two insurance policies.
Right. We
Wow,
take other
that's
ones also, like
Oh, yes.
Lakeside. We're with Healthcare Partners, and I've been with Lakeside Medical Group before it was even Lakeside Medical Group. It used to be Family Practice or Family Medical Group. Yeah.
FHP?
Yeah, FMG, Family
Oh,
Medical
yeah.
Group. Yeah.
FMG.
And
Well, does
yes, with
M-
Dr. Leiter.
Mm-hmm.
Yeah.
Oh yeah, Dr. Lya. Does Medicare cover
No.
hearing loss?
Yeah.
Well, it depends on your insurance with the
Medicare will cover the hearing test.
The hearing test
They
it
will.
covers.
Yeah.
But the
Yes.
hearing aid is a different story.
That's
but
something different.
How about-
Medicare will not cover the hearing aid. However, we are trying to get a bill passed.
and that's the big thing.
That's
I mean,
critical because hearing aids are very expensive.
Yes.
I know my husband wears them, and he no longer says what, and that's so nice.
Right. So what happens as you say that, Barbara? What happens is that people, that are seniors are on a fixed income, most of them, or limited income, and so they wonder why should they go to an audiologist versus one of the big box stores, where like Costco, where you can get hearing aids for less money.
So do they perform a hearing test
Yes.
like you do?
Yes, but most of them are not audiologists. But the reason is because you go to an audiologist because an audiologist is a diagnostician.
Right.
So not everybody that comes to get a hearing test needs hearing aids. Some people do have wax in their ears. Some people have fluid in their ears. Some people have the 3 little bones in their middle ear not working properly, and they need a medical referral to an
Well-
ear, nose, and throat specialist.
Well, how can you see inside the ear? You use some kind of special tool that it goes right into the ear, and
Yeah.
you can see that there's wax there or that there's some other problem.
Yeah, so
An
you,
otoscope.
yeah, we
It's a
have.
what?
Otoscope.
Otoscope.
Yeah. O-T-O.
OTO. Otoscope.
Not as opposed to A-U-T-O.
Auto.
Yeah.
With the
Otoscope.
steering wheel and wheels and you drive it into your ear. That doesn't work. But O-T-O
Otoscope.
scope.
Yeah.
Otoscope.
So we can see wax and, other
Well, we
pathology
also have
that
a
might-
video otoscope, and we allow people to see what the inside of their ear looks like.
Oh, that would be interesting.
But there are certain diagnostic tests that you cannot always see the three little bones behind the eardrum.
Yeah, typically,
So
a
we have
scan,
tests.
You have to use a scan for that because it's behind the eardrum, so you're not going to see the bones.
Interesting. Interesting.
For our seniors, you were mentioning that, there are challenges sometimes for our seniors that, especially the one that where they're resistant to technology. Even with the hearing aids the way they are, they go, I don't want this, or I'm not going to know how to use this. Don't you find sometimes that, the senior patient themselves, their kids might bring them in. My mom needs a hearing aid. Please help out. But then the patient has Parkinson's or a tremor, can't put the batteries in, has struggles to get it in their ear, or they have visual problems and can't always see whether the switch is on or off, things like that, and don't know how to use sometimes in really nice hearing aids. You can use a remote. They don't get that kind of technology, and that's a challenge for you, isn't it?
No, because basically hearing aids are very simple. We fit the type that the person can use, and there's always help around. The batteries have to be changed once a week, but that's about it. So all you have to do is put it in. It's all automatic. You take it out, you open your battery door, that's it. That's all you have to do. So it's very, very simple. So we know how to teach people what to do, and we make it simple.
Don't you find, though, because I know, just go around the community and I see these patients and, their kids will tell me and their spouses will say to me, we tried a hearing aid. They lost it. They couldn't do it. You hear all these stories that they didn't succeed in that endeavor, and they're still saying what?
Right.
That's harder, isn't it? I mean,
Yeah.
seniors they all come out differently. We're all functioning differently, and they're not able to. Some of them just aren't capable of handling all of this. They just don't.
Right.
So
Well,
it's hard.
Most
I
of the
think-
seniors, you find that sometimes they have home care when they can't handle things like that.
Yeah, but we're getting more and more of our seniors, like we were talking in the first segment about, of staying home, and they're living on their own, and they might get periodically a caregiver in to help them out, but it's tough. We're going to have to figure out a different system of how living situations are, and I think we're working on that
Yeah.
to a certain degree, but just some of our seniors are going to suffer with that hearing loss, and I don't think we're going to do anything about it. That's the hard part. So I know it's.
I don't know. I
for-
like to think more positively,
course
but
you
you're
do.
the
You
one
have
that you're the one that
I
goes
see
into
it.
the houses and takes care of the patients. So.
and stand there when they
in
don't
their
hear
house.
the doorbell.
Right.
Stand there again. I'm rapping, and then I'm lucky if I call them up, they pick up the phone, they hear that. I'm at your front door for the last 10 minutes. Hello.
Yeah.
I say, oh, sorry, but that's the way they're living life.
But there are things like lights that flash when the doorbell goes off, and
Yeah.
all those kinds of
All
things too.
But that's technology, and some
They
of
don't have to
them-
do anything about that.
Yes. Sometimes they just don't get it.
Well, can we go back to insurance coverage? Say the senior is on Medicare and has that's their primary, and they have a secondary of maybe Anthem Blue Cross or something. And Medicare pays for the initial hearing screen.
Right.
Then what happens? The senior is then stuck with paying for hearing aids if they need them. Then how on earth do they pay for them?
Well, we
Because
do have payment plans,
Okay,
and we have
that's-
payment plans with 0% financing.
Okay.
So there are ways we can do it, and they don't have to be that expensive. The lower priced hearing aids of today are 10 times better than they ever were before. So we work within people's budgets, and we try to help them out so that they can do it. And, you know, I get a lot of people telling me, well, but then I won't be able to go on my cruise. Well, you know, it's a matter of priority.
That's
Well,
true.
what's more important to you?
That's true.
You know, people, when they want something, they manage to get it. It's just that that's the last thing that people think is important,
Yeah,
is
that's
their
the problem.
hearing.
That's very
They
true.
don't realize the impact that it's been having on
That's
them.
right.
And how not only are, in a high degree, they're suffering, but the people around them are suffering also.
Mm-hmm.
Because you've told your loved ones, oh, you need to do this at this certain time, and they didn't hear you. You need to take this medication. You know,
Right.
you need that. We're going to your doctor's appointment at 2 this afternoon. Please try to be ready. And they're not ready
Right.
when you show up because they didn't hear you. So it has impact
Yeah.
long term. And yeah, it might be okay to have a cruise, but you know, it's a priority.
Yeah.
So we're going to
All
take a
right.
break.
That's right, we are. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS.